Epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Epilepsy affects both males and females of all races, ethnic backgrounds, and ages. Having a single seizure doesn't mean you have epilepsy. At least 2 seizures without a known trigger that happen at least 24 hours apart are generally required for an epilepsy diagnosis. Seizures are the main symptom of epilepsy. There are 2 types of seizures, generalized seizures and partial seizures. There are 6 types of generalized seizure, which is absence seizures, tonic seizure, atonic seizure, clonic seizure, myoclonic seizure, and tonic-clonic seizures. The second seizure is partial seizure, which is divided by 2. First, simple partial seizure, which doesn't involve loss of consciousness, which had symptoms like alteration to sense of taste, smell, sight, hearing, or touch. The second is complex partial seizure, involve loss of awareness or consciousness. Its symptoms include staring blankly or unresponsiveness. There are possible causes for epilepsy, which include traumatic brain injury, serious illness or very high fever, stroke, other vascular disease, lack of oxygen to the brain, or brain tumor. There is no cure for epilepsy, but the disorder can be managed with early treatment that include: first, anti-epileptic drugs. This medication can reduce the number of seizures you have. In some people, they eliminate seizures. Second is vagus nerve stimulator. This device is surgically placed under the skin on the chest and electrically stimulates the nerve that runs through your neck. Third is ketogenic diet, which they must take low carbohydrate in their diet. Last, brain surgery. The area of the brain that causes seizure activity can be removed or altered.
Epilepsy, in its simplest form, is a neurological ailment characterized by recurrent seizures and abrupt behavioral changes caused by increased electrical activity in the brain of the patient. The most hazardous aspect of the condition is that it will substantially reduce the quality of human life. Around 70% of patients have difficulty to control epilepsy. The objective in this study is to identify the main cause of the occurrence of epilepsy disorders in a person. Second, to determine effective treatments in addressing epilepsy disorder. And the last one is to identify the communities with the highest values in epilepsy disorders.
To prepare for our group project, my team used Google Form to be used as a medium to conduct the survey to ask the people who have epilepsy. Before making the survey, we do a little research on the internet searching for information related to epilepsy. We create a few multiple choice questions according to specific and personal matter about epilepsy to the targeted people. This is the example of the survey that we have made. After the survey is complete, each of us pick one participant that has answered the survey to be interviewed. We take a screenshot of the interview to be used as a proof that the conversation between us and the target audience is really occurring.
Next, we go further with the discussions of the data obtained. First, both graph above shows that the age and gender data. Most of the respondents of the epilepsy survey among the students mostly 20 years old with the percentage 60%, while for the gender, female is 53.3%, followed with the male 46.7%. Secondly, university with the highest percentage is UiTM with 30%. Next, we go further with the data of the cause of abnormal movement in epilepsy by the respondent, where we can conclude that the cause is due to the problems of the brain with the percentage of 43.3%, followed by the brain injury 40%. These two causes are really the common effects of the epilepsy disorder. Next, the first data shows that 60% of the respondents state that they never or do not have these kinds of disorder, followed by 16.7% of respondents had an epilepsy for last 6 to 12 months ago. For the data of the second questions, where the respondents state that they had an experience of having a jerking body movement, uncontrolled laughter or difficulty speaking, with the higher percentage of 46.7%. For the experience lapse in awareness, hearing and tasting or smell something, data shows that respondents of 46.7% experienced that problem. Conclusion for the experience, 43.3% had the experience of the epilepsy symptoms. Next, the questions about what really happened to the patients during epilepsy attack. According to the respondent survey, they said they couldn't remember what really happened during the epilepsy attack. Next, data shows that 83.8% of respondents reported no movement lasting more than 5 minutes, while 10% reported it. In connection with that, 36.7% of respondents state that they only take 1 to 5 minutes only to back to normal, while 26.7% take 5 to 10 minutes. This shows that every person takes a different duration of time to back to normal after getting attacked by the epilepsy. Next, types of medications did patient take from the suggestions of the doctor. Mostly they get anticonvulsant pill with the percentage 40% and nerve stimulations with the second highest is 30%. According to the respondents, the side effect after taking the medication is tiredness and dizziness. In scale on side effect significant change or impacted on routines of epilepsy patients, most of the respondents stayed in scale 1, so it proved that this epilepsy does not affect their routines with a percentage 40%. Last but not least, the data percentage from the respondents shows that they did not miss taking their medication in last 1 year with the higher percentage of 56.7% and 30% of the respondents missed to take their medication. The most reason of the respondent for them to miss take medications is due to the lack of times and the cost of the medication with 20% and 60.7%.
In conclusion, epilepsy is a very awful morbidity that can cause a very bad life experience. Epilepsy can limit the activity that can be done by the patient because of the main symptom of the disease that happen to patient, which is seizure, is unpredictable. It can happen anywhere or anytime. We hope the epilepsy patient can be cured and can live a normal life like normal people do.